Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us once again for our weekly press conference on Delaware's response to COVID-19. We have our team, our A-team here today. Again, Dr. Carol Rattay, the Director of Division of Public Health. Many thanks to her and her team for everything they continue to do as we start off this new year. AJ Shaw, the Director of the Delaware Emergency Management Agency, some real important updates to give today that are part of AJ's portfolio with respect to testing and some of the relief efforts coming from our Delaware Army and Air National Guard. And of course, we have Pam, our sign language expert for the deaf and hard of hearing. We've got a little bit of positive news, so we're got some optimism in our presentation today. Still guarded optimism. For sure, we're still not out of the woods yet with this winter surge post New Year's holiday, but it seems like we've seen a leveling off, or at least for a couple of days, of the new positive cases, of the percentage of tests that are done that are positive, and most importantly, on our focus with the total number of people hospitalized with COVID in hospitals across our state. So let's go right to the data dashboard and take a look at those numbers. You're still 7-day moving average on number of new cases is really high at 2,500. You'll remember back in the summer when we were trying to get under 100 new positive cases per day. A part of that, of course, is that we're testing at all out at increasingly high numbers, and we'll talk a little bit about that. But even with those high numbers, we have almost 30% of those tests that are done that are positive. And so a very high number, lots of spread in the communities, lots of people getting tested, and that's a good thing. We'll talk a little bit about that. This number last week, however, was just over 30%. So a little bit of an improvement there. On the hospitalization side, remember that's where a major focus of ours is, and helping the hospitals decompress and reduce the number of people in those hospital facilities. And we've had physicians from the hospitals on our last two press conferences and administrators there, and to tell you directly what the situation looks like in the hospitals, whether you're in Sussex County at Beebe or Tidal Health or at Bay Health in the middle part of our state, or whether you're Christiana Care at Wilmington and Newark, or whether you're at the VA hospital or St. Francis or Nemours. All our hospitals have more COVID patients than they've ever had in the last 2 years, and their overall census is as high as it's been as well. So that's where our primary focus is. We did have National Guard help this week. We'll talk a little bit about that. I can tell you that the feedback that I've been getting from the hospitals has been incredibly positive about that support. It's mostly non-clinical support. It's just a big morale boost for all those frontline health care workers in emergency rooms, in the hospitals, doing administrative work, doing whatever the hospitals need in a non-clinical way. We've got, by Thursday, we'll have another deployment, so we'll be up to 150 Delaware Guards men and women. We'll talk a little bit about that as well. So we're at 683 in terms of the total number in hospitals. That's down from 759. Coincidentally, on January the 12th, I say coincidentally because if you look at the roller coaster ride from the beginning to the peak of last January was also on January the 12th at 474. So at 683, we're still significantly above the peak of last year, and that was at a time where very few people were vaccinated, and we were pretty shut down. There weren't a lot of people in the hospital for other things, which was helpful. Now, lots of other folks in the hospital for other conditions. You can see that in the next slide, where you see the gray is for those hospitalized, and the number that we've reached there on January the 10th was the highest number that it's been over the last 2 years since COVID. A significant percentage of those patients in the dark blue that you can see are people that are tested with COVID, or maybe they're there for the COVID severity of their illness. a combination of the two, something that we're looking closely at. But again, 2 or 3 days in a row where we're down from 759. So the situation at this point over the last several days is not getting worse. And that's a good thing. It's getting a little bit better. Hopefully we'll see a peak there, but that we'll keep our powder dry on that and see what happens over the next several days. We do have efforts to help the hospitals decompress. Talk about that in a minute. AJ will report on it later with respect to the deployment of National Guardsmen and women who have had training to be CNAs being dispatched to our long-term care facilities, enabling the hospitals to discharge elderly patients to those facilities who otherwise wouldn't have the staff to accommodate the care that they would need. So let's look at the vaccine update. We know that the most important thing that folks can do to help us tamp down this surge in cases and to help us control the spread of COVID is to get fully vaccinated and boosted if you're eligible. You can see we still have vaccinated at very high rates, 65%, 633, almost 34,000 fully vaccinated. That's of the full population, including the little ones who aren't eligible, and then the breakdown by age below, 69% for 5-year-olds and over fully vaccinated, 74% 12-year-olds and older fully vaccinated, 76%. You see that I rounded up there for adult Delawareans 18 and over at fully vaccinated, and then 65 and older, 93% fully vaccinated. Dr. Rattay will talk a little bit about boosters. We still need to get folks their booster shot if they're fully vaccinated to get full protection, and Dr. Rattay will explain that. One of the big challenges that we have faced over the last couple of weeks now, since the Christmas week and week after Christmas, is testing across our state as the awareness has grown and as the positive cases and folks that are symptomatic has grown. We've got a much greater demand for people to be tested, and that's a very good thing. We are currently testing at a rate full out, all of our resources to test. If you could update the slide there, the daily testing performance, where you can see we've reached the peak now in early January at almost 9,000 a day, which is over 60,000 a week, far in excess of the estimate the CDC made back 2 years ago that we would need to test about 80,000 a month, and we're doing 60,000 a week. AJ will talk a little bit more about that. We have testing available. You can go on Delaware's website, de.gov, get tested, to show those places. There are the opportunities there, state service centers, public health clinics, our pharmacies across our state, the curative trailers, which are out deployed in various communities. There happens to be one in the neighborhood that I live in. I stopped by last night to find out what the demand looked like. They did 500 tests that day, in which they said was a slow day for them. And so they've had a peak days just after Christmas and New Year's, and they continue to be available to folks in and out of that area of our northern part of the city. And they even get folks that work in Delaware from other states. We got news on our White House call today that President Biden, as you may have heard in the news, is making available 1 billion rapid tests that you can get through the website covidtest.gov. That's covidtest.gov. I'm told that the website is up and active, and so there's been a high demand for rapid tests here in Delaware and across the country. Each of the governors that joined on the governor's call with the White House have been requested the availability of that. So here you can go directly to that, get a rapid test at covidtest.gov from this allocation. You can see our testing, just the results that come through our system, 62,323. Our daily tests performed, as I said, 8,918, a peak like we saw last year with pretty much the highest demand that we've had. And help has arrived. With the next slide, you can see the new testing drive-through testing site that was tested out yesterday, a dry run through where they tested a couple hundred folks. This will be available for a couple weeks at the Delaware City DMV. EJ will have more on it. Appointments are required. We do want to make sure that you get an appointment there. So there's the website to get your appointment. Do I need a COVID-19 test.com? Do I need a COVID-19 test.com? The DMV site in Delaware City will be open Mondays and Tuesdays and Thursdays and Fridays in the evenings, not Wednesday because they're open for a motor vehicle business on Wednesday evenings from 5:30 to 11:30. So ample opportunity for folks that are going to work every day to get to the DMV and get an appointment to get tested. And then on Saturdays, again, when folks aren't necessarily working, from 8 to 4 on Saturdays and 10 to 6 on Sundays. So help has arrived by way of FEMA there for testing, and help has arrived for the hospitals by way of the Delaware Army and Air National Guard. Heartfelt thank you from the hospitals directly and the employees who work there to our guardsmen and women who've already been deployed. Some, I think, 50 to 60, AJ, and more coming by Thursday. We'll have 150 that will be deployed to hospitals across their state. I know they've been welcomed with arms wide open. We appreciate their efforts. We do need additional help. The Delaware hospitals need your help. If you're a retired or former healthcare worker, please contact the Hospitals Association, DEHA.org/hospital help, DEHA.org/hospital help to fill out the form. We've contacted higher ed to see if we can get some of the students who are in training for nursing and allied health, as well as our high schools for the same thing. General volunteers are accepted as well for non-clinical roles, the kind of roles that we have our Army and Air National Guard doing in hospitals, and they have been welcomed relief for so many of those folks that have been under the gun the last couple of weeks. Just a reminder that we do have an indoor mask mandate, that masks are required in indoor public settings. I can tell that it's making a difference already with folks putting their mask back on. We really appreciate that. We know that it'll make a difference. It will help prevent additional spread. We're at a point where we have transmission of COVID-19, particularly the Omicron variant, which is very infectious, loose in our state. Mask will help tamp that down. Please think about it when you enter your convenience store, your gyms, your restaurants. If you go to the local convenience store, your bars, hair salons, and the rest, wear your mask when you're indoors, in respect for the employees who work there and your fellow citizens. There has been a real demand for masks. Dr. Rattay is going to talk about a little bit more about how to appropriately wear a mask and what kind of mask that you should think about. The state will be providing 120,000 KN95 masks to students 6th grade and above, and to teachers and childcare providers. We'll be distributing them directly to our partners in the schools and the childcare facilities, and we'll be distributing them to the children 6th grade and above, because the masks that we received are for an older person, larger masks than the little ones for the real little elementary children. So about 120,000 of those KN95 masks coming. Just one last thing, by way of a advertisement for our town hall meeting online tonight, community information session on our proposal for the Wilmington Learning Collaborative. We've been working on this now for several months, been doing town hall meetings in person and on Zoom online, meeting with teachers and staff, school boards. we did get a unanimous approval from the Christina School Board to move forward there, and are helping from similar approvals from Brandywine School District and the Red Clay School District. Last but not least, if you haven't been vaccinated, haven't been fully vaccinated, or need to get your booster, you can get your COVID-19 vaccine at de.gov/getmyvaccine. Really important that you do that. We've seen a little bit of an uptick there as the awareness about the spread of the Omicron variant spread across the state this month. And so hopefully that will continue. And with that, I'm going to turn it over to Dr. Rattay with thanks for everything that her team is doing at Public Health. Dr. Rattay?
Thank you so much, Governor. And as you said, we are pleased to see that our case and hospital rates are not increasing at the same rates that we had been seeing in the previous few weeks. However, our case rates and our hospital rates remain extremely high. And so this is definitely not the time to let our guard down with Omicron. And also there is more we need to do in preparation for future variants. So in regards to variant information, for sequencing of specimen collected from December 24th to December 30th, the Omicron variant represents 93% of variants sequenced, and Delta's only 7%. So as you can see, I mean, Omicron by far now is our predominant variant that we're seeing in Delaware. So today I really want to focus my remarks on the importance of getting your booster dose of the vaccine if eligible, as we are clearly seeing the importance of this with the Omicron variant. And only 30% of the Delaware population aged 12 and older are up to date on their vaccinations. We need to double down on increasing the number of Delawareans who have received their primary series and their booster shot. When we look at the vaccination status of our cases for the week of January 3rd through January 9th, 53% of cases were unvaccinated, 60% of hospitalizations were unvaccinated, and 72% of deaths were unvaccinated. And this is not surprising knowing what we know about Omicron, and I'll talk a little bit more about that. But what's important here to see is that 88% of cases were not boosted, and 91.4% of hospitalized individuals were not boosted, meaning the vast majority of our cases and hospitalizations were among individuals who were not up to date with their recommended vaccines, really calling into the importance of boosters. So again, why does this matter? Why are we seeing this? The current COVID vaccines target the spike protein on the COVID virus, and the Omicron variant has many mutations on the spike protein, which helps it evade antibodies, which are generated from both prior infection or the two-dose vaccination. So with Delta, the antibodies from the vaccine or from prior infection were offered more protection against the infection. We're seeing that less the case for people fully vaccinated or who've had prior infection as it relates to preventing Omicron infection. However, Moderna says its booster increased antibody levels against Omicron by 37 times, and Pfizer said its booster increased levels by 25 times. Now, fully vaccinated still protects against severe illness, but the boosters are much more likely to block the infection, which is important for many reasons, including for prevention of future genetic mutations. So on the next slide, I want to share a little bit about an article that was published in the Journal of the American Medical Association, or JAMA. In fact, there were two studies from Israel involving over 5 million people. And together, the findings of these studies indicated that the primary vaccine series, it does lead to a relative effectiveness of about 90 to 95% against serious illness or death. So again, the primary vaccine series can be helpful against serious illness or death. But if you have the booster vaccine, that's 99 to 100% effective against that serious illness or death. So while boosters may not entirely squash breakthrough cases, the chance of hospitalization is meaningfully much less. So where to get boosters and who should get boosters? Let's start with who should get boosters. Now, anyone over ages 12 should get their booster as soon as they're eligible, meaning if it's been 5 months since you've had your second dose of Pfizer or Moderna, or 2 months after your single dose of J&J, time to get your booster. And you can go to de.gov/getmyvaccine for a vaccine location near you. So on the next slide, really just to sum up, we are not where we need to be with vaccines, with only 30% of the population age 12 and up that is up to date with their vaccines. We've got some real room for improvement. So please get your booster shot to get yourself and your family members up to date on your vaccines. It really is the best way to protect you and your loved ones. So I want to shift gears and talk about masks yet again. You may have heard about the announcement from CDC late last week, expanding their mask recommendations to emphasize protection, fit, and comfort, and to include the use of N95 respirators or KN95 masks. And really, this is consistent with what we have been saying for a while, including during the past few weeks at these press briefings. But let me allow me to break this down a little bit, the update that we're seeing from CDC. First and foremost, it is so important to remember that any mask is better than no mask. And I need to emphasize this point again. Personally, I've asked the question of nearly everyone I know who's become infected and believes they know how they became infected over the past month, which is, were they wearing a mask at the time they believed they were exposed? I don't know anybody who was wearing a mask at the time that they believed that they were infected. And there's lots of reasons for it, riding in a car with someone else who's fully vaccinated, not to be judgmental, but the reality is not having a mask on at all is really how, we're seeing so much spread of infection. So what CDC is saying is, any mask is better than no mask, but make sure that whatever mask you wear, that it fits you well. And we've talked about that a lot. Make sure that there's no gaps around your face, and make sure that you will wear it correctly and consistently. Correctly meaning over your mouth and nose, and wear it at all times. Like a car seat, where the recommendation for the best car seat is about choosing the one that fits your child and fits your car, and that you can use correctly and consistently every time. It's the same with masks. For your best level of protection, CDC continues to recommend that you wear the most protective mask that fits well, is most tolerable to you, and that you will wear consistently and correctly every time. So while masks and respirators provide all masks and respirators provide some level of protection, properly fitted respirators provide the highest level of protection. So we've talked about cloth masks. They do provide the least protection, especially if it's single layered and doesn't have a filtration layer. Multi-layered masks can make a big difference. Disposable masks are better at filtration, but often there's gaps around the face. KN95s therefore offer even more protection, and a well-fitting NIOSH approved respirator, an N95, offers the highest level of protection if it's worn properly. If it's not, it's going to be less effective. So I said this last week, but I'll say it again. CDC's guidance around N95s is a little bit different than what was said almost 2 years ago, which is at that point, we needed to save N95s for healthcare professionals. And while we still should only have surgical N95s used by healthcare staff, a lot of N95s are available out there. This is especially important now for individuals who are older, who are immunized, or who are, I'm sorry, for older, immunocompromised, or are not up to date with their COVID vaccination, or are in higher risk situations, like if you're visiting a hospital or a long-term care setting or in a crowded indoor setting. That's where it's especially important to have a more protective mask. On the next slide, I'll just mention with respirator fits. Some respirators are harder to tolerate or wear consistently than others. And so well-fitting mask, or surgical mask with a cloth mask, may be better than a poor fitting respirator, especially if it's not comfortable. A respirator should form a seal around the face for it to work properly. If there's gaps around, respiratory droplets can leak in and out. So that can happen if you've got the wrong size or type of respirator, or if it's worn with facial hair. So if you are wearing an N95 respirator, make sure you're following the manufacturer's instructions, or you can view an instructional video on CDC's site. Again, it's important to note that most respirators for the public are disposable, but can be extremely effective in preventing spread of infection. On the next slide, I just want to give a big shout out to the United Way and other partners for hosting a town hall style call tomorrow evening at 6 p.m. with several esteemed Delaware physicians who will answer questions about COVID. So be sure to tune in tomorrow evening for this virtual event. And then finally, just a reminder of the important things we all need to do so we can get through this winter surge and move to the future of living with COVID. As we shared, the majority of those who are hospitalized are unvaccinated and unboosted. This is having a tremendous impact on our hospitals. So again, if you are eligible, please make sure you get your first or your second dose and a booster. For masks, again, wear a quality, well-fitting mask. It makes a big difference. For testing, if you have COVID symptoms, have been exposed to someone with COVID, or are unvaccinated, please make sure you are getting tested as is recommended. And please stay home if you're ill, even if you have mild cold-like symptoms, until you've been tested. And please continue to avoid non-essential social gatherings. And with that, I'm going to hand it back to you, Governor. Thank you.
Thank you very much, Dr. Rattay. Thank you for the great work of your team. Thanks for that really important information about mask wearing and all the things in this slide here that each of us can do to try to stamp down the spread of COVID. We've seen incredible positive numbers, over 2,500 now on a 7-day moving average. That's 2,500 a day. We're testing full out, AJ. AJ is going to give us an update on that. Over 60,000 a week, a day. And so a lot of work going on there, AJ.
Good afternoon, sir, and thank you. So no, we did have another strong week last week with testing. We were, I think 61,000 the week before, a little bit over 62,000 last week. If we go on to the first slide. So you see there's a continuation of increasing numbers here. That is good. As the governor also said, help is on the way with an additional site open 6 days a week, evening hours and weekend hours. That will hopefully also increase this number. We know there's, a demand still. We are trying to, traverse the state as best as possible and identify locations where we could do the most good. At the same time, I want to make sure we remind people about the at-home process. With Vault, you can get the link at de.gov/get-tested. This is perfect if you need it for employment, if you need it for traveling. Really, it takes, you could schedule it, in advance to work to your advantage. And then you don't have to go register for something a few days before or stand in line or, potentially miss a date. So it's a very, scheduled type process where you could, have the ability to get your test results back, on the day you need them for whatever process that may be. So we can go to the next slide. Talking about the hospitals, the National Guard, we cannot thank them enough. I had the opportunity to talk to some of General Barry's folks just yesterday, as we're bringing on another unit today for assistance in the hospitals. So last week we activated 56 Guard members to go to the hospitals around the state to fill in the non-clinical aspects, adding about another 100 more today and tomorrow that will be hitting the hospitals tomorrow through the end of the week, from everywhere from Nemours all the way down to Tidal Health and BB and Sussex. And we've had some great feedback from the hospitals into the force multiplier that they've been in some of these responsibilities they've had. And why are we doing this? Well, this is why. The hospitalizations continue to stay high. We've seen a favorable trend in the last week. However, our overall census in the hospitals with COVID and everything else is still at a all-time high. We want to make sure that we provide support to our healthcare facilities that we can. And we know there's not, I think I explained last week, there's not a reserve corps of doctors and nurses out there that we could send in there to assist. But what we can do is provide good hard workers that will adapt to anything that's thrown their way. And that's what the National Guard's done, not only for the hospitals, but for the state for the last almost 2 years now. The other part of this that we're doing to help the hospitals is, as we've talked about now for about a month, is the CNA education that we did. So we sent just under 100 Guard members to a 2-week crash course at Del Tech. Those members right now are finishing their practical hours as well as taking their certification testing. They will be integrated into long-term care facilities and skilled nursing facilities across the state over the next several days, with the intent that we provide them to help with their staffing model and open up beds so they could accept discharges from hospitals. Again, another mission where I think if you ask those Guard members when they enlisted, whatever that was, is you think you'd be going to Del Tech for 2 weeks to take a class and then go into a facility? No. But again, these individuals, long days in class, studying for the tests, doing their clinical hours last week in facilities, having to get their background checks done, their vaccinations done. So a hectic 2 weeks to start the new year, but they did it for their state and their community, which is an outstanding way. And another way will help the hospitals decompress. So like I started, they've done everything we've asked them to do. Can't thank Major Malloy, Lieutenant Colonel Pennington, Sergeant Major Fields enough for really being creative with making sure we get the Guards into locations where they could do the most good for the state. Lastly, I think Dr. Tay, we'll talk about the testing event. Yesterday, I was out there with our federal partners in public health and Del.gov. So even though the federal partners come in and kind of do the testing, public health has a footprint there, as well as Del.gov and state police to assist us. And this is going to be a 6-day-a-week program that will do up to 1,000 tests a day. You do have to get registered. You go to de.gov/get-tested to get that website, the same one the governor started the press conference with. Results in approximately 48 hours. You stay in your car. It should be a pretty flawless process. They'll start in about 3 hours for a full day today. Yesterday was a training day, dry run, making sure the process worked. But we're expecting nothing but a very smooth process there over the next 3 weeks. And can't thank our partners at the CDC and FEMA for sending in assistance. And then again, a big thank you to Del.gov and the public health staff that will be out there supporting. And then finally, I'm going to close with talking about vaccination, something that Dr. Tay hit upon, and that's the boosters. This weekend, the Lieutenant Governor, Senator Poore, and others held a vaccination clinic at Wilbur Elementary. They did over 500 vaccinations of first dose, second dose, and boosters throughout the event. Very successful. It just shows you that the community power that's there when something is organized and brings people, to an event, kind of the Field of Dreams mantra, if you build it, they will come. But it was great to see, because we saw a increase in booster rate and actually vaccination rate up until the holidays, and then it plateaued a little bit, and now we're doing what we can to increase it. But this was something that, honestly. It wasn't the state. This is a pharmacist that worked with a lot of community members, including the lieutenant governor, and they got 500 people, vaccinations, and that's what's going to help us, move to the next step of this pandemic. So thank you to all those individuals that helped with that. I know it was a cold day for the Del.gov folks outside or people walking in and out, but 500 people is 500 people we didn't have on Saturday vaccinated. So appreciate their effort and coordination with that. So Governor, back to you.
Thank you, AJ and Dr. Rattay. A lot of good news there, a lot of activity going on with those testing rates. I think I misspoke earlier saying that we were doing 60,000 a day. I think that's the wish being the father of the thought. But when you think about what CDC said we would need to do on a monthly basis, something like 80,000, that was 2 years ago, and we're doing over 200,000 when we're maxed out at 60,000 a week. And so lots of opportunities to get tested. We appreciate the support from FEMA with the DMV operation over the next several weeks. That will take some pressure off the pharmacies and other locations. Remember about President Biden's information today, his website there to get a rapid test. That's an important thing for all of us, and for getting yourselves tested when you need to be tested. If you haven't been vaccinated, make sure you get access to our multiple opportunities to get vaccinated. Most people are getting vaccinated in the pharmacies and have been now for a couple months. There's plenty of capacity there. With respect to the testing at the DMV site in Delaware City, remember to get your appointment first, and it's a drive-through event. It's open in the evenings, except Wednesday, because DMV has their regular business on Wednesday, and then Saturday and Sunday for hours during the course of the day. So thanks again to our Army and Air National Guard. As AJ said, our major focus is on the hospitals and helping them decompress, discharge patients that don't need to be in the hospital. They need a place where they can go and get treatment that they need in our long-term care facilities, and that's where these guardsmen and women will be deployed to. And that help is on its way. And so with that, I know we have media that has joined the press conference again, and we thank you for that, and we'll take any questions that you have now.
Thanks, Governor. The first question is going to come from Meredith Newman of the News Journal.
Hi there. I have two questions regarding the mask news that was just announced. Governor, can you explain why distributing masks to the school setting, especially when infection rates are so low and there already is a mask mandate? And my second question is 125,000 is a lot, but it's also a drop in the bucket when compared to the millions that other states are providing to residents. So is there any plans to provide more masks to the general population?
Let me start with the second part of your question first, as we don't have plans at the moment to do that. We did decide to focus on our schools because it is our highest priority to keep children in schools. We know that schools are safe places, you're right, but in many ways it provides the kinds of masks that folks need to prevent that spread. As I said, it is a high priority. And so we're focusing on those students. The masks that we're able to acquire are those that fit a larger face than the little ones. And so that's the reason around the targeted population there. So we're excited about this opportunity. We have a lot of testing that's going on directly with the schools, again, with the purpose of keeping them in-person instruction. We know that's challenging for many schools and districts because staff and teachers are testing positive and have to sit on the bench. But we'll continue to focus on that high priority.
Great. If any reporters have questions, feel free to raise your hand on Zoom and I will call on you. Governor, next we're going to move to a pre-submitted question from Chandler Parr of WRDE. Chandler asks, when could we expect cases to peak in Delaware? And are we seeing any leveling off yet?
Yeah, so we do get that question all the time, and it's something that we're very attentive to. We've had, as I said earlier, when we went through the data, at least a 2 or 3 day now leveling off of the hospitalization number, down from 759 on January 12th to 683 yesterday. That's positive news. We don't want to prejudge anything for the long term with just a couple days data point, but hopefully that it does coincidentally. It is the same day, January 12th, as our peak last year, which was on January 12th. We'll see whether that holds true, but we're hopeful. Obviously, we've also seen a leveling off in new positive cases, and importantly, a slight reduction in the percent positive. But those numbers, as Dr. Rattay said, are still incredibly high. The hospitalization number at 683 compares to 474. You can see that on the screen now, the peak of last year. And we know that there are more people in the hospitals for other conditions. The 2,500 new cases compares to that summertime low of fewer than, considerably fewer than 100 per day. Obviously, those are the best days. And the percent positive, we try to get below 5%. That's the World Health Organization target. And we're still at 28% and testing at very high levels. So the numbers are still really off the charts, but we're hopeful that it's not getting worse. And hopefully we'll see over the next several days and week as we help the hospitals decompress. I can tell you that these reductions, I think, are giving our hospital personnel some level of hope, in addition to the morale boost they got with the arrival of the Army and National Guard. We'll have the guards, men and women who've been trained up to work in our long-term care facilities, ready to go, enabling the hospitals to reduce that 683 number even further. And so we feel like we're making real progress in each of those areas.
Our next question comes from Tim Mastro from Delaware State News.
Hi, all. One question on the mask mandate. Just wondering, what's the status of how it's being enforced? I know early on in the pandemic, you provided education and some warnings, and last winter kind of shifted to a zero tolerance policy with more fines being leveled. So just where does that stand right now?
Yeah, so I'll turn it over to Dr. Rattay or AJ, but you'll remember me answering that question a couple weeks ago when we put it in place that said that we weren't going to enforce it with a heavy hand, that we were going to again call for folks to comply with the mandate and hope that they will. And frankly, the compliance that I've observed, obviously anecdotal, has shown a real difference in public spaces. You can obviously see the difference as you circulate in grocery stores, the Wawa I drop by every morning, and all the other places. There's just a greater awareness. It also creates a greater awareness that this is a serious situation. People are seeing that in their own households and communities as people test positive. I think about my own circle of friends and had many who've tested positive or had a family member who did, and that level of awareness, I think, hammers home the need to do, really a small thing and wear a mask when you're in public places. Dr. Rattay or AJ, anything to add to that?
Yeah, so for the most part, we're seeing good compliance and we're grateful to that. If there are concerns about compliance, just like last year, our health system protection section will accept complaints or concerns and will raise awareness and educate again. At this time, though, enforcement is to occur through law enforcement rather than public health, as the public health team is very focused on vaccination, testing, and the many other aspects of dealing with this winter surge.
Our next question is going to come from Joe from Delaware Public Media.
Good afternoon, Governor. The DSEA president issued a statement, sent out a letter today, and she was concerned about the masks, which you've already addressed here, but also she mentioned that school COVID cleaning protocols are not being kept up because of the limited number of daytime custodians available, and she wants those. From the teachers, they want that to be resumed, and she's worried about the classes being combined to cover for teachers, as well as kids are arriving later because of the driver transportation issue. Is this something that your administration has looked into and you might try to help districts as we move forward here?
Yeah, it is something that we're paying a lot of attention to. It's a difficult one, Joe, because each district and each school in the districts is situated a little bit differently. You mentioned transportation, bus drivers is one of those variables. Maintenance staff is a variable. Teachers in classroom is a variable. We did take action to try to invite retired teachers to come back and to waive a certain provision that would be a financial deterrent for them to come back in the classrooms. It is difficult from our perspective because it really is a school by school proposition in terms of those levels. We're focused really hard on bringing the surge down so that the number of their staff, we have the same problem in state facilities, but the number of their staff with COVID is reduced. And, we're just going to have to keep our nose to the grindstone through this month as we peak and get healthier on the other side. We did talk about a couple weeks ago, entertaining conversations about whether the Guard could be deployed to do non-educational functions. That's still something that we're looking at. It doesn't look as promising and maybe as it once did, and we're very focused on the deeper decompression deployment in our hospitals. But it is a very big concern. We are cognizant of those issues that the DSEA mentioned in that letter, and we are on regular contact with the school superintendents to hear the situation in each of their districts. And I can say the one consistent thing is that every district is different. And so it makes it a little bit harder for us to do that. We thought, as I mentioned earlier, that acquiring these masks for students and staff and teachers would be a way to show our support for keeping children in school. We know, and the teachers themselves believe now that that's the most important thing, but a difficult thing during a winter surge like we're experiencing.
All right, Governor, that was the last question.
All right, very good. Again, thank you to each of the media for joining us today. We appreciate your participation and helping us get the message out to Delawareans. The message is really pretty simple. Do those things that we know help reduce spread. Wear your mask in indoor public settings, in your grocery store, at the restaurant, all the different places, at your local convenience store. Make sure that your children are masked up if their school is in-person instruction. Help us by keeping socially distant. So there are the things that are on the board. Just being careful about coming in contact with folks in crowded indoor situations. We need everybody to pull together so we can squash this spread. It's been it's a worse situation than we've had over the last 2 years, and hopefully we're seeing the peak coming here over the last couple of days, and we'll be improving from here. But that obviously remains to be seen. It is what we hope to see, and we will continue to work with our hospitals. Special thanks once again to the Army and Air National Guard for the deployment of their men and women to our hospitals and the support that they're providing for those frontline healthcare workers. For those that have been volunteered to be trained to work as CNAs in the long-term care facilities, we thank you as well. To our partners at Delaware State Police, all the partners helping with the testing site at the DMV in Delaware City, and to our wide ranging network of vaccinators pushing that 62,000 vaccinations on a weekly basis. We appreciate your efforts. And to AJ and your team and Dr. Rattay and your team, thanks for all they do. And we'll join you. We'll see you next week.